Hello, everyone. This is Heidi with Downtown NorCal Live, and today I have the co-owner of Physical Edge in Davis, Matt Moore. Hi, Matt.
Hey, how you doing, Heidi? Thanks for having me.
So I'm going to just disclose right up front, I am a patient of Matt's, and I have been with him since 2015, giving him a lot of gray hair.
It's been a pleasure working with Heidi. So she's a very good patient.
Sometimes. So can you just talk about your business in general? You have a very comprehensive approach, not just physical therapy there.
We do. We have it's something that I learned way back when I had worked with my original partner, Bud Castle or Stuart Castle. He had a model of physical therapy and a fitness center with it as well, too. And so when me and Bud decided to go into business probably 18 years ago, we kind of took that same model where we have physical therapy or rehabilitation services, and we also have a fitness center associated with it, which makes a really good transition for people after or actually during rehab. A lot of times they don't need to see us 3 days a week. They can see us once a week, but we have the gym available so they can come in and do their stuff another 2 days a week. Also, it makes great for a good transition after we get done with rehab to keep things going and keep their fitness level. And all of a sudden it turns from rehab from an injury or after a surgery into a fitness routine as we go through. And so part of that model, we also have personal trainers that we have at Physical Edge. We have classes, we have yoga and Pilates classes. We also have a movement class, which is something that we really is designed to help you bridge the gap between and maintaining the gains that you made in physical therapy and doing that in more of a group setting as well too. So that's kind of the overall model. We also added Dr. Vo, who's a chiropractor who he doesn't work for us, but we help to manage his practice, and he's an independent practitioner here as well too. So we have physical therapy, we have chiropractic, and we have fitness and personal training and classes is all part of our overall model that we use.
So in normal times, the footprint, the commercial footprint you occupy makes a lot of good sense, and obviously for personal care reasons. But now, how hard is it to maintain that space?
Well, our current model and how our system works, since we had the governor shut or the Yolo County shut things down, we've actually closed the fitness center. So we have about an 8,000 square foot facility. And I'd say at least half of that is devoted to the fitness, or maybe a little more than that. And there's definitely some reasons to close the fitness center when we were dealing with things and trying to flatten the curve and stuff. But because physical therapy is considered essential and important, we've been able to continue with our physical therapy. And so what we've done is we've tried to make it as safe as possible. So we have this 8,000 square foot facility. We have 6 therapists that are working. And so what we've done is, in order to continue to see patients for physical therapy, we've spread people out. So in our PT room, where normally we might have 6 or 7 therapists working in there, we've actually kept it down to 3. And then we put 2 treatment areas out in the fitness center. And we actually put a treatment area in the multi-purpose room where we do classes as well too. So we're trying to spread everybody out in terms of keeping distancing. We used to have we still hopefully someday soon will have our internship program back, where we have all these great undergrads from UC Davis that help us out. We've had to do away with that, of course, to try to minimize that. We are also increasing kind of our treatment times by a little bit so that we don't have any dovetailing that goes on. So it's really just the patient and the therapist, and then that patient will leave and we'll have a new patient come in with it as well too. So we minimize overlap as well. We've been treating with mask, which I never had to wear a mask in my life, but it really stinks to have to wear a mask for 4 hours. You have lunch and then you come back in the afternoon, you put the mask back on. We also wear gloves, and certainly we're disinfecting everything. We put time in so that we have time to clean everything up as well too. So our therapists, who are usually spoiled with interns, are now cleaning and everything and making sure everything is as safe as we can for all our patients. And that's, I think, worked out pretty well. And I feel pretty comfortable that our patients, when they come in, are safe. They feel safe. And it allows us to continue to give the essential care of physical therapy right now.
Knowing the facility as I do, the way you're describing it, you are far exceeding any 6 foot distance.
Yeah.
Yeah.
Right now, behind me is our PT room, and on the other side of the door is Dan Lieb, who's one of our physical therapists. And walking back here to take this meeting, he's got him and one patient, and that's in the entire physical therapy room, which is probably about 2,500 square feet. And so it's not like that all the time, but we have plenty of space to spread everything out as well, too. So.
You've talked about the safety, so that was going to be one of my questions, but I wanted to ask you safety for people. A lot of medical professionals are talking to me about the fact that they are seeing patients too late. And so I'm guessing there might be some of that happening in your facility. What can you say to people who are choosing to ignore symptoms or delay visits to their physician or come in for physical therapy when it's needed?
Well, let's start big picture. I'm really concerned about this. I worry about people that I have had some history of skin cancers, and I get my skin checked a couple times a year, and I worry about people not being able to do that. And what are we missing with people? I worry about people who, we've kind of taken and called things like low back procedures for pain, right? Like an SI injection or a disc epidural steroid injection as kind of elective things now, when it's kind of scary for people and they're in a lot of pain, and it really limits their progress with rehab. So I'm worried in general that I hope one of the first things we open is what I think is this other essential healthcare. And I think the reason we closed it is we were worried about the hospital systems getting inundated. I think that doesn't look like the issue. And I'm hoping that that's one of the first things they open. It's just making it easier and let people know it's okay to go see your doctor's office. I know they're gonna do a really good job with all the safety measures that they do as well too. I do worry in physical therapy. Right now we're seeing we work Monday through Friday from 8 to noon, and we have 2 days a week. Right now it's Monday, Wednesday, and going into Friday. Today's our first Friday where we're seeing patients in the afternoon, and we see patients till about 3:30 right now. That's what our demand requires from us, or that we need to do. Hopefully, as things go and people feel more comfortable, we can expand that back to our normal hours as well too. But I am worried about those patients. Our caseload right now is filled we have it primarily people that are post-op patients that really need the treatment. Post-op rotator cuff repair. You can't wait on that. And if you do, you're going to ruin the whole thing because you're going to lose motion. A lot of post-op knee patients as well too. What's interesting is those patients we don't have new ones coming through because we're not doing knee replacements right now. We're not doing hip replacements. So that's one thing I worry about, that people are holding off getting care there. I do worry what happens when if we have back pain that's debilitating and you're not able to feel comfortable to come into physical therapy to get those things dealt with. I worry about the long-term effects with those things. I worry that little problems become big problems. And I understand why people are holding off now, but I do worry about that. And there is going to be some consequences for us not taking care of people because we have these concerns with the COVID. And I realize that's a big concern, but I also worry about the other end as well too, is people not getting care that they need.
Yeah. And now some of your work, and a lot of it is just hands-on, but at times you can do some remote, telehealth. And you and I had a very successful session recently on Zoom. How's that going?
Well, it's been good. I honestly, when I first started doing the Zoom, I consider myself a hands-on manual therapist. So like, come on, if I can't put my hands on you, we're not going to get what we need done. But I think it works really well for follow-ups. Like you and me, a lot of times you're a great patient, you know your stuff. You just need some guidance of where to emphasize things, or you have a couple questions on how to do a certain exercise, or your exercise homework list is pretty long, and there's it's hard to remember 8 million things. So
yeah, it's long.
Yeah. And to have a session like we have where we can go over stuff and we can communicate, because we've seen each other before, we've done our hands-on stuff, and a lot of it's maintenance now. So that's a great situation with it. I had a patient I saw the other day who was my sister-in-law had a good friend who's in Chicago, and she had a dislocated her knee, and she'd been in a brace for the last 6 weeks, and her doctor says, you can go start physical therapy. There was no physical therapy for her in the area, which I was amazed at because we're open here, but everyone has different rules how they're functioning with it. So I literally saw her through a telehealth visit. She was in Chicago, and she really just needed to get her knee moving, and she needed some questions answered. And I showed her some basic stretches and exercises, and we were able to do that initial evaluation, and it went really well. I have another one with her next week. We'll see. We'll do the Zoom meeting once a week. It would be better to get my hands on her and loosen some things up. But she's very motivated, and I think she'll do really well with what we started until she can get into physical therapy. So I'm not a huge fan because I would rather get my hands on people with it. But I think it's a really good tool right now. And just recently, every insurance company we take, which means probably every insurance company around, is now allowing telehealth visits. So if there's people out there that know they need physical therapy and have questions, telehealth is a really good way to do that. And I know all the clinics in town in Northern California, a lot of them are doing this. And if you don't have anybody, we'd be happy to see you. If you don't feel comfortable coming in, you can set up a telehealth visit, and we can do a telehealth just to get you started on stuff, answer questions, make you not so worried about what's going on, or help you start the process of getting better until you can get into for hands-on physical therapy as well.
Now, for the uninjured, people who just need some basic movement right now, we're all used to being more active, but we're at home, and a lot of walks happening. But what are some online suggestions for people who've never had an exercise program?
I think this is, I come from a background of this, is I think too often that people, the first step towards fitness, I think, should be good movement, right? I think that's really important. If you have a really tight ankle and you try to go running on that tight ankle, it's going to cause changes in pressure on your knee and your back. And I think that can get you in a little bit of trouble. So our personal trainers here and us as physical therapists, we always take a look at movement to try to identify some of those areas where people, if they start loading that area, they might cause them problems with it as well too. We call it altered motor control. So if you don't move well, we call that altered motor control. We like to get your motor control at least to a certain level before you start a fitness program. Now, that's very difficult to come in for a screen or an evaluation with a physical therapist right now. So I always think a good place to start for people is making sure that mobility is good. And two really good ways to go after that is looking at doing some basic yoga classes, really basic, or basic Pilates classes, because their fundamental thing that they do first is mobility, where they get your joints moving, and also they work on stability, which is how I function here. You need mobility and stability, then we need fitness on top of those things. The question becomes, how do I go get that? I think that we have certain places that are offering Zoom classes. So if you've been to a place before, if you've been to a studio, give them a call. They're probably doing Zoom hosted classes that you had before with it as well too. We're looking at putting our movement class onto a Zoom platform as well too. Our movement class is where people come in and have been patients before, but they have a little trouble and they need a little help every once in a while. So what we do is we set up a little circuit of mobility work, and then we go through and go through their basic stability exercises, like learning to squeeze your glutes, right? And remembering where those glutes are, and working your postural muscles as well too. So certainly Physical Edge is a place you can come in for that as well too. I know things like Debbie Ernesty does a class at the Davis Senior Center. They can't do that right now. So she's doing that through Zoom as well too. So look online for the Davis Senior Center and look online for the Zoom classes they do there. I think it's important that I would encourage people, it's really tough right now. We need to stay fit. We need to do something to keep moving, which is a little bit tougher. I think I tell people all this time, what did you do before? Like if you're not exercising now, what did you do before? If that was with a personal trainer, most personal trainers are doing Zoom sessions one-on-one with things as well too. If you went to a Pilates class to keep things going, I think you can find videos online. You can do apps on your phone that will take you through those things as well too. If you're a walker and people always say this, it's too hot right now. Well, it's not really hot until like, 10 o'clock in the morning. So get up a little earlier, go for a walk in the morning, get things going. I've helped 3 of my patients get a bike for inside their house because it's so important with it as well too. So I think if you ask yourself what you want to do, what you like to do, and what you're going to be compliant with, and then go after that. If that happens to be online stuff, then I think there's lots of resources out there for you to go after those things.
So just ending on a personal note, you're the first person I have interviewed who has a high school senior. How hard is it at home right now?
I'm very proud of my high school senior. So her name's Sydney Moore, and she just found out because she found out she's officially into UC, University of California, Santa Barbara, and we're very proud of her. It's been a very hard last month and a half. Sydney is she's been in student government the whole time. So she's one of those kids that's into putting on rallies. She's the kid with the megaphone at the football games in front of the senior center, leading cheers for things. She's the one helping different other members of the StudGov. She put on the parade for the homecoming parade. She was in charge of it. So it's been really hard. And honestly, it's been very difficult because she has access, and here's the conversation that the student government people have with the administration. And I think she's been a little frustrated with what the administration has come up with and looking at the virtual graduation. And I really think that there's a movement right now. A lot of parents, kind of heard about a virtual graduation, said, no, these kids have worked way too hard. I mean, we all have those Davis kids. It's such a, they're amazing kids, but they work really hard to get here, and they should have a chance to celebrate that. And so I think there's some things happening in my house, including Sydney. She's written letters to the school board and to her principal, followed up by my wife, who's also done those things. And so there's a movement right now, and things are happening, and I'm really hoping that they can try to do some really special things. I've heard things with schools doing graduations at drive-ins, so things would be separated. I've heard about people doing little parades through the school or around the school where the teachers are there, their parents are there, they're getting their yearbooks, they're able to wear their gown and do something with it as well too. You see things like, I believe it was the Air Force Academy that had their socially distanced graduation. So I'm hoping something can happen, because I really think it's important that these kids get honored for how hard they've worked. And personally, I really want to be there and celebrate my daughter. We'll do that anyways in our own family, but I think the community really needs an opportunity to go out and celebrate these kids. And I know all the parents want to do that, and all the kids want to do that as well too. So I think things are happening now. So. Well,
and I would just add that it's a community thing. My son is much older at this point, but our community's with those kids. And I feel like Davis is full of creative people who have an ability to put amazing things on. And I'm with you. I hope it happens. So I've been talking with Matt Moore. He's the co-owner of Physical Edge Physical Therapy in Davis. Matt, thanks for joining us.
Thank you very much for having me, Hattie. I appreciate it. Thank you.